Hey there guys, it's me, Jacob again. I'm here because I'm making an instructional video about how to inject testosterone. This one goes out to follower of mine on Tumblr, Starbuck McGuff. You rock, buddy, and congratulations on starting T. Alright, first things first, you want to get your basic supplies. You want to wash and sanitize your hands fully. That is important. Anytime you are dealing with some broken skin, there is risk of infection, and you want to minimize that. You want to get some rubbing alcohol or any kind of alcohol that's not drinkable. Hand sanitizer works just as well if you don't have liquid rubbing alcohol. Those little like sanitizing wipes that you can get from restaurants, just stock up on those. Those are great. You want to have your testosterone, and you want to have one syringe needle attached and one extra needle. Okay? First thing you want to do is you want to open up your testosterone, get that out of the package. This is a 1 milliliter vial. Any testosterone that you get before it's been opened is going to have this little seal on top. It may or may not be green, but it is for me, and it always has been. So you just want to flick that off, like so. And if you can see up here, you're going to see that there's a little rubber interior. That is where you're going to inject your needle. Now, you want to open up your syringe. Take that out of the wrapper. Make sure the needle is in very tight. You do not want the needles coming out while you're injecting into the vial or into yourself. This right here, attached to my syringe, is a 23 gauge needle. That is a little smaller than usual. This is the needle I'm going to be using to extract my testosterone. You can use really any gauge needle to get it out. The bigger the better, because testosterone is very thick. So the bigger the needle, the easier it'll be for you to take it out of the vial. Now, standard pharmacies sell, I think, up to 18. I just have 23 because that's what I bought in bulk online. You want to pull back on the syringe until you have as much air in the syringe as testosterone you were extracting. So if you were extracting half a milliliter of testosterone, you're going to want half a milliliter of air in there. Pick up the vial, stick the needle in the vial, and push the air in. Vial upside down. Pull the plunger back on the syringe, and suck out all that tea. You can kind of see. You can't really see, but it is filling up. Get out, as much as you need. And remember to get out just a little bit extra, because some of your testosterone is going to stay in the syringe. That's just how it is. Let me give you a demonstration of how much extra to take out. You want to take out a whole bunch extra. So this is a milliliter. You can kind of see, there's some air at the top, that it's a milliliter, and then there's one little notch above. And I'm going to take a picture of that to post in addition to my video as an instructional. Give me 1 second there. Just so you can see how much extra to take in. Because about between the two lines, that's about how much is going to stay in the syringe. So take out that much extra. And this right here is 1 milliliter or 200 milligrams. And pull back the syringe some more so that all of the testosterone is sucked out of the needle. Now you're going to want to recap your needle. The reason you're doing this, the reason you're switching needles, which is what we're about to do, is because rubber is very tough. It is tougher than, or about as tough as human skin. And used needles hurt. Used needles hurt a lot. You never want to use a used needle if you don't have to. So, take that off. That is going to go in your sharp spin. Open up your new needle. Be careful not to touch the inside because it's sterile. Screw that on. Make the plastic nice and tight. This is a 25 gauge needle, which is what I use to inject because I am a huge wimp about needles. Most guys use 21 or 22 gauge. Those hurt. I like 25 gauge. It takes a little bit longer to push the testosterone out because the hole in the needle is smaller, but there is less pain, so it's worth it in my opinion. Now, while this is on, while the cap is on, you can set that down. You're going to want to prep your leg. I do not know how to do a butt injection. I never have done that. That seems kind of weird to me. I do know that with a butt injection, you need to use a little bit longer needle, about 1.5 inches, and I do not like needles. This is 1 inch, so that works well for me. Now, I'm going to move this over here so you can see. That is my gloriously white leg. And what you're going to want to do, take the cap off of the needle. And you can see how little that is? I mean, it's long, but it's little, you know? And give the needle a few flicks. And the reason why I pulled the syringe back so much and left so much air in there is so that none of the testosterone stayed into the other needle. So we're saving it all. We do not want to waste the testosterone. We've waited a very long time to get it. So, flick it a few times to make sure all the air bubbles come to the top. Slowly press up on the plunger so you see a little drop come out. Once you got that, you are good to go, my friend. About the injection itself, a lot of people want you, let me see if I can do something to make this a little bit easier to see. Does that help? No, that really doesn't help. Never mind. A lot of people want you to aspirate. What aspirating, so you can see my face. A lot of people want you to aspirate. What aspirating is once you have injected the needle into your skin, pulling back on the plunger, making sure you see blood, or making sure that you see air. I'm pretty sure it's making sure you see air. I don't do that. I was taught that I did not have to do that. The reason why is because this is an intramuscular injection. You are shooting this very deep into your muscle. It is very, very, very unlikely that you are going to hit directly into a vein. You may pass through a vein, you may nick a vein, and that causes bruising, bleeding, and is generally to be avoided. But you are not going to inject directly into your vein, and even if you did, the worst thing that would happen is that your body wouldn't be able to use all of the testosterone. It's not going to hurt you, it's not going to kill you. I think it actually takes up to 2 cc's of air to give you an air embolism and to cause any kind of fatal or permanent damage, but you still don't want to risk it, so don't get air in your system. Okay? Now, got the leg. You want to make sure you're in a good, comfy position. It's going to be there for a little bit. My leg is very white. I apologize. Part of that is the glare. Part of that is, well, my computer. And part of that is just my skin. So, you want to give your leg a little shake. Make sure, experiment with the different positions. Some people like to have their leg up. Some people, most people like to sit. Some people like to sit off the edge of the bed and have their legs hanging. Depends what position you find your muscles comfortable in. You want your muscles to be relaxed and not tense. The tenser they are, and the more you tense, the more it's going to hurt, and you don't want it to hurt. But in reality, it doesn't hurt that bad. So you got your leg. You're going to pinch the skin and make a little hill on the muscle. You want to inject about mid-thigh, not too close to the knee and not too close to the genital region. So, just about in the middle. You see that? Give it a little pinch, and then at the top of the hill, you want to take your needle, and the faster you do it, the less it hurts. So take a deep breath in. Ow, fuck, that hurt. Sorry. I'm gonna try that again. Even old timers screw up. And deep breath in. Deep breath out as you inject. Ta-da! Hands free. But you probably shouldn't do that. Push the plunger down all the way. Yep, this hurts. This is a generally unpleasant experience, in my opinion. Once that's down all the way, pull that out. Got that needle free. And put a little pressure on that. You, my friend, are done. That is it. Now, excessive, if it's bleeding, that's really nothing to worry about. That's pretty normal. Any bleeding should stop after about a minute or so. Don't be freaked out. If it bruises, don't be freaked out. It definitely takes some time and some practice to learn, where on your body you like to inject, how you like to do it. It's, tempting to go slower. Faster is easier. That's really about all the tips that I have. I'm sorry that my camera is such poor quality. I hope this was informative. And there you go. Good luck again, buddy, and thank you very much.